Dozens of workers at a hospital in rural Indiana are out of a job tonight. Highpoint Health announced yesterday that it would be laying off and reducing hours for more than 80 employees. 9 on your side's Whitney Miller is finding out why.
The administration here at Highpoint Health say they had to make the tough decision to let staff go because of several financial struggles. They say one of the biggest problems is the drop in the number of patients they treat. Employees at Highpoint Health want to know what the future holds for their careers. On Wednesday, they found out the nonprofit acute care hospital was laying off 31 people and reducing the hours of at least 50 employees.
People rely on their jobs for their livelihood and take care of themselves and their families, and we affected 81 folks. Really a difficult time.
Michael Schwebler is the hospital's president and CEO. He says in recent years, the health facility has been facing financial challenges that are forcing administrators to make some drastic cuts.
The volume of work that we do here at Highpoint Health has steadily declined over the last few years, actually greater than 30%.
Now the hospital is restructuring, it says, to ensure there is a future.
Looking at growth opportunities and ways to become more efficient at what we do.
So how will the hospital get more money, and will there be more jobs in the future?
All the changes that we're making are to ensure the financial viability of this organization well into the future, because our community relies on us, and so do a number of other more distant communities.
Schwebler says Highpoint isn't the only hospital in this situation. According to a study conducted by the North Carolina Rural Health Research Program, at least 95 rural hospitals have closed since 2010.
We have a very sick and an older and generally poorer population that we have to care for. We have a lot of uncompensated care, and we have a lot of expenses.
Administrators say that employees that were let go will receive a severance package based on the length of employment. Schwebler also says that these cuts only account for less than 5% of the workforce. They say that will not affect the level of patient care. For now in Lawrenceburg, Whitney Miller, 9 on your side.